Yesterday, the country welcomed Christmas babies, and as much as there is a lot to celebrate, there are also concerns among the number of young as well as teenage mothers who gave birth. A concern that Limpopo Health MEC Dr. Phophi Ramathuba said society needs to not turn a blind eye to. She visited the Mankweng Hospital outside Polokwane yesterday and has called for law enforcement agencies to intervene in order to protect teenage girls. Let's now extend a warm welcome to Limpopo Health MEC Dr. Phophi Ramathuba. Dr. hearty festive greetings to you. Thank you so much for joining us this evening. Firstly, talk to us about your observation on the current state as well as readiness of Limpopo hospitals during this festive season.
Evening to all your viewers out there, and Merry Christmas. We're still on the Christmas mood. What we can indicate as the Department of Health in Limpopo is that all our facility, because when we do disaster preparedness, we look firstly in terms of the response to motor vehicle accident or any trauma or any medical emergency that could have happened. And you will remember that as a province, we have recently has been launching and allocating new ambulances. We're looking at from N1, from our station in Bilavila up to the stations in Musina, where we make sure that the entire N1 road, all the stations, we handed over 11 in Bilavila, go to Mudimole, we did, Mokopong, we did, Polokwane, we did, up to Musina. And then you also look at the R71 from Mankweng. On Thursday, we were there with the executive mayor, where we also handed a fleet of 10 ambulances. You move to N11 from Groblersdal up to Riboni stations towards Groblersdal Bridge. So in terms of the roads, and also looking at other roads, so that in terms of response, we are prepared. And up to so far, we have never received any call since our project of countdown towards 500 ambulances has started. The response time has drastically improved, and we are really satisfied with that. Now, coming to the hospitals, we met with all the CEOs and demand that they give us a preparedness, state of readiness in terms of the human resource that will be there, focusing on your trauma units, your casualty, your X-ray department, your pharmaceutical, are the medicine available, is the staff available, your other employees that supports both the doctors and the nurses during the emergencies. But not only that, we know that a hospital cannot function without power supply, with the anticipation of load shedding, because we were not sure we'll be in a better position or not. We had to make sure that every facility of us, especially starting with the hospitals, have got a reliable generator that has been properly maintained, serviced. The amount of fuel, diesel, it's there in case of a disaster. We also look at the current challenges we have of water, to say all the municipal managers, we've got their contact numbers. In case there will be water disruption from municipality, do they have water tankers to can help the hospitals? Are our boreholes activated? We went further to look at the groceries in our kitchen. Will the patient have shortage of food? Those are some of the few examples that we look at, because everybody will be on leave. And then in case of a disaster, when you have to do emergency procurement, do we have supply chain staff that is on duty during this period? And up to so far, during this weekend, everything was smooth, although the burden of disease as a result of trauma and road accident really put a strain on our healthcare workers and our hospitals.
Now, MEC, one of the biggest issues that you pointed out yourself was, of course, the growing number of teenage pregnancies that you noted. And, of course, yesterday, when you went to welcome the babies, there were most of the mothers were underage girls or teenagers. And this is not just a Limpopo problem, Doctor. The rest of the country has frightening stats. Talk to us about this scourge.
It's a real challenge that year in, year out we continuously raise. The mere fact that we highlight this because we do statistics of babies born on Christmas, it's also to show the public that this is what we are experiencing on a daily basis. It's just that on Christmas, even media is interested in knowing who are the Christmas babies. Therefore, we felt it's important to raise this challenge. Our first baby to be born at Malamulele Hospital, 5 minutes past 12, was born out of a 15-year-old mother. And the first question that came to my mind is that when did this mother fall pregnant? Obviously, 9 months back, she was 14. And when did she start to be abused sexually? Because the reality is that there's no law in this country which allow a 15-year-old or a 14-year-old to engage in sexual activity. So that is where the problem is. And the major challenge that we're facing as health workers is that we're trying to support basic education score to say any 15-year-old pregnancy must be reported. We work with our social workers, social development, and we call police. We work well with SABC. They come, they open the case, they look for the perpetrators. If they are fortunate, the parents will cooperate and will be told the name of the father. But the other challenge is that even where we have opened the case, there's never been any successful prosecution of the perpetrator because the parents still come back and withdraw the case and say, this father has owned up to the pregnancy and this father will be responsible for the child, has paid the damage. Now, there is still a lot that we must educate society to say, having a child is not a crime. The crime here is that activity which led to be a girl child being pregnant. That sexual activity, which is defined by South African law as statutory rape, is the one that we must deal with. So that is where we are still finding a lot of problems. Cultural beliefs and all sorts of stories that we find parents putting a pressure on the girl child not to even talk about who is responsible. So we feel a lot must be done. And also the other area which we are raising with officials in basic education is that when a teenager falls pregnant, it is important to raise alarm at the time of pregnancy, not to wait for the delivery, because these deliveries are complicated and difficult. Even this particular one that I'm referring to. Firstly, the weight of the child was 1.9 kilogram, which is 1,900 grams. It's not the ideal weight. It's low birth weight. And that has got its own challenges. If you look at the infant mortality rate, most of these babies who died have got low birth weight and they are born out of teenage mothers. And many other complications, which if I to start giving the complications on the child and also complications on the pregnant teenage mother during the pregnancy and after. So hence we are saying we need to strengthen our system and start reporting immediately when we pick up that this teenage mother is pregnant, so that we don't wait like now when the child is already born and we want to run around with the police. Investigations must be done during that particular pregnancy, because pregnancy on its own, it's a sign that there and evidence that there was statutory rape, a crime has been committed.
Absolutely, Doctor. And in closing, I mean, going forward and at the back of what you've just said, what can we then as citizens, parents, as well as communities do to ensure that we eradicate this type of behavior and protect our young girls from engaging in or even being forced into early sexual activity?
You see, more can be done. For instance, I usually categorize in the 17, 18 years who by law they are allowed. That's where we usually go to schools and talk to them about abstaining and what is important in terms of them focusing on their education. We need the support from everybody else, including the churches who are against us having to teach the girl child and the boy child about sexual education, which that is to protect the child. Because once a child knows the do's and don'ts, once they've got information, they will be able to know what to do. But unfortunately, there are those within the society feels it's a taboo to talk about sex with your child. If you look at babies that were delivered in private hospitals, they are not experiencing the problems that we are experiencing in the public. So meaning this is a problem of the working class. It's a problem of public schools. Hence, basic education wants to intervene with this sexual education. But some of these churches, where even the pastors themselves are responsible for this pregnancy in the name of praying for the girl child, we've got to deal with that as society. Secondly, would be a 15-year or 16-year-old who's someone who's underage. This one, we don't even negotiate and talk about abstaining.
Yeah.
We must get the police involved because a rape has occurred, and whoever it is. And lastly, until such time we will get an individual accused of statutory rape because the teenage girl is pregnant, and be prosecuted successfully and spend years in prison, this thing is going to continue because people don't see any consequence management. Hence, I'm saying, as a province, what we've done moving forward is to get the whole team of social development, health, basic education, sports, arts and culture, South African police services to work together towards making sure that consequence it's there on the perpetrator and protect the girl child. Because the girl child at the age of 15 doesn't know what's happening.
Thank you, Doctor. That was Dr. Phophi Ramathuba, MEC of Health in Limpopo.